And we are here to go over our NCLEX question of the day. Thank you so much for joining us here. This is Remar Review. I'm Regina Callion. I have the pleasure of going over this very important NCLEX topic. This is Let's Talk NCLEX, where we're going to go over content, questions, and answers. We're doing this every week to make sure that you guys are prepared when you sit down and take your state boards. It is one of the biggest tests of your life, and you got to be prepared for it. I will say again that the information that I'm sharing must be super important. Is that better? I'm getting the thumbs up. All right. The information that I'm sharing must be super, super important because we had a tough time getting on our broadcast today, but we prayed and we worked it out. So I'm just going to have our prayer partner come back up again, say a quick prayer for us, and we will get started for everyone studying. Okay, and we have Crystal taking her NCLEX tomorrow, so she's requesting prayer. We're just going to do a general prayer over this broadcast and that we remember what we studied. So welcome, Mark Callion.
Hey, everybody. So let's go ahead and take a moment of reflection and yield time for prayer. All right. Father in heaven, thank you once again just for another opportunity to claim your grace over our lives. Lord, without you, we could do nothing because in you is life. And so we just thank you for the life that you have given us. And also we want to give our lives back to you, Lord, and asking for your protection, for your guidance, and your overall lordship over us. As we have nurses, Lord, that are preparing to study, ask that you would be with them to give them the courage to believe that they can achieve the goal that you have set before them. We have nurses, Lord, that are preparing to test. I ask, Lord, that you give them the mindset of victors, Lord, so that they can be victorious and also come back and give you the praise, glory, and honor. This is our prayer, Lord, that you will be with the students as they study, as they learn, and as they reach their goals. In Jesus' name we pray. Amen.
Amen. Thank you, Mark. Okay, you can do it. I like that. You can do it. The encouragement. So this is Let's Talk NCLEX, of course, but I have to start with an amazing testimonial. I don't know if you guys saw the video, but oh man, I'm just gonna show you Cassandra, Nurse Cassandra. She passed her NCLEX, and her video today inspired my Monday motivation, which I'll be doing on Monday. But just an introduction to Monday motivation is Nurse Cassandra, who was out of school for 5 years. 5 years, had a tragedy in her life that I want to say, and she may be on, or she can maybe describe it more, but it paralyzed her. It affected her emotionally. It delayed her goals. But she was able to overcome all of that. And she said she did it with the help of Jesus all the time. I was patiently waiting for God to bless me, to realize he never stopped blessing me, for he was waiting for me. He was waiting for me. And if you listen to that video, it is just the biggest inspiration for somebody who had every reason to give up, who could have been still in the same place, but decided to just take steps forward by faith and continue to press on with the love that she carried for her brother in her heart. And she accomplished her goal of being an RN. So again, congratulations, Nurse Cassandra. You will be our focus of Monday motivation. Check out our video today if you have time. It's right on our Facebook page. You guys know how to get to our Facebook page, obviously, if you're watching me here. But if you need an extra booster uplifting for this weekend, this is your girl to listen to. So this is NCLEX question of the day. I'm not going to belabor it anymore. But our question was about management of care, of course, because that's been our theme for almost 2 weeks now. We've been talking about issues of prioritization, delegation, supervision. And we had a scenario. Well, can I just show the scenario? Perfect. Nurse Jane asked registered nurse Rachel to observe her patients while at lunch. One of the patients falls out of bed. Which nurse is responsible? So this is a classic scenario. Happens all the time in the workplace. What do you do? These are the choices. These are the choices. Who's responsible? Number one, Nurse Jane, who was originally assigned to the patient, is responsible. Two, Nurse Rachel, who was observing the group of patients, is responsible. Three, neither nurse is responsible for the fall. And four, both nurses are responsible. So I got a chance to go through some of the answers that you guys posted. Thank you for participating. And of course, they were divided. There was one person, I'll just start with Vedette. She thought that nobody was responsible. Her rationale was that falls happen all the time. So a patient can fall at any time. Really, you can't blame it on anyone. But Christy, she was she said number one. She said that the nurse should have secured, Nurse Jane should have secured the patient before going to lunch. Tiffany as well agreed. Loveland said Nurse Jane, she cannot delegate. You can't delegate the task of observing a patient to somebody else. Who else? Pima said Nurse Jane is responsible because she did not formally assign her group of patients. So there were people that had some really good reasons why the original Nurse Jane, was responsible. Then there were some people that thought Nurse Rachel is responsible for that patient's fall because she took on the assignment, right? So William Mester said, when you accept responsibility, that becomes your patient. Lizzie Vick said the same thing. She accepted responsibility. Joel said that she was the one who was supposed to be watching the patients. And even now, I'm seeing a lot of different answers come in. And some people, were really going back and forth between Jane and Rachel. So I asked the question, whose responsibility is it, just to reorient the way you guys are thinking, whose responsibility is it to determine competence when it comes to caring for a patient? When it comes to caring for a patient, who is the one that gives the green light whether a nurse is able to care for a patient? This is a good one. Because, at the basic level, it's always the registered nurse, right? The registered nurse is supposed to determine whether a person is competent or enough to receive a patient, to receive a task, right? But here you have an instance of, two registered nurses that are able to take a patient. So actually, you guys that are going back and forth, the correct answer is going to be, let me show you, the correct answer is going to be number four. Number four. And the reason why both nurses are responsible, and you're right, it doesn't even, Nurse Jane, it doesn't even say that Nurse Jane is a registered nurse, but we know that she has a set of patients, right? So at any point, let me get in here. At any point, as a registered nurse or a licensed practical nurse, you have a responsibility. That when you give someone else your patients, you are appropriately transferring the care of that patient so that the patient is safe and the continuity of care can proceed forth. And it doesn't matter if you're going on lunch, if you're leaving the floor, if you're going home, wherever have you, you have a responsibility to formally hand off your patient in all situations. So Nurse Jane failed because you can never say, just observe my patients while I go use the bathroom. All right. Already right there, you have become negligent because you have not properly transferred a patient to another appropriate caregiver. Okay. So she failed there. And then Nurse Rachel failed because she assumed responsibility for patients essentially that she could not care for. All right. And she could not care for them because she didn't receive a formal report. She didn't know anything about them. And there was no appropriate communication between those two healthcare professionals. So both of their behaviors, both of their actions reflect negligence and should be reviewed. So Kathy got it right. Adrian Reyes got it right. Deepa also did. I was going through, and Haley, yep, Haley, you got it right. You're on my list. You said both. Harris Johnson, good job. Norman Samuel, Allie Pepper says, because of their level of education, they're both negligent. They're both negligent. And so this opens up our discussion of a skill that you have to have as a nurse, and that is how to legally hand off a patient, particularly for the NCLEX exam. And if you're doing management of care type questions, you will see the language. It will say hand off, sign out, cross coverage, and shift report. So all of those things essentially mean hand off for your patient. All right. So what are some things that it entails? What are some things you have to be mindful of? Because if you get it wrong on the exam, that could be a red flag. All right. So the definition of handoff, and I got this from the Joint Commission's website. It says to transfer critical information and allow for continuity of care or treatment for a patient. So this is the process that has to take place. You have to transfer the most important information so that no one is harmed. And if there's a failure to do so, then you get these kind of things. All right. So ineffective handoffs more than likely will contribute to medication errors, patients falling. I hope this makes sense to you guys. Wrong site surgery, patient deaths. So it is a very dangerous point in a patient's stay in an inpatient unit or a nursing home or anywhere where they're receiving care. If the handoff is not done appropriately, then there's a lot of room for medical error to occur. Okay. Some people might ask the question, why do bad handoffs happen? I mean, the research shows that like 20% of the time that something happens to a patient, usually it is because of poor communication amongst the healthcare professionals. The reason why it happens so frequently is because in nursing, schools don't really teach us how to give handoff reports. Or I know my school didn't. I mean, it wasn't a class. It wasn't something that we practiced in clinicals very extensively. I mean, it just wasn't something that I was prepared to do when I graduated and when I got my first job. So I was really bad at it. And I remember passing off a lot of unimportant information and leaving out the critical stuff. So like I remember I would tell the nurses about, the patient having a family pet at home, or if it was like his wife's birthday, but I would not tell the code status of the patient, or I didn't understand the importance of knowing who the patient's primary physician was until I was more seasoned as a nurse. So I think that's one of the contributing factors to why handoffs can be very difficult for new graduate nurses. There isn't a certain way everywhere that people do it. I worked for a travel nurse as a travel nurse for a couple years, and every hospital that I worked at had a different way of doing handoffs. Some of the hospitals, they recorded them on a tape recorder, and the nurses went in a little room and listened to them. Other times it was face-to-face at the bedside. Other times it was just, write a note in the computer, in the Epic charting system. So there was no structured way to give a handoff report. And so because of that, the communications were variable, and it could definitely lead to mistakes. Yeah, mistakes. I'll talk about the shirt in a minute. All right. Yeah. And I know some of you guys can feel that because you working even in the hospital, maybe as CNAs, or if you're LPN, or if you're in a different field of medical care, you still have to give handoff reports, and it's different everywhere you go. So it's one of the skills that you acquire with experience. We're going to try to change that though. So you have to ask yourself during the handoff, are you the receiver or are you the sender of the patient? Because as I was looking at the JCO website, it says right before you give a handoff report, you have to assume one of these roles. And the best ways to become a proficient handoffer, if that's a word, is to give a face-to-face report. That is the best way to do it. And I know this isn't necessarily like NCLEX information right now, but it's practical information, and it's something that will help you once you hit that floor. So my advice as well, in becoming proficient in giving handoffs, is get to work early. One of the things that I really benefited from was going to work early and being able to look at my patient assignment and then sit down and look through the chart. So when I would get to work early, like if I didn't have to start until 7 a.m., I would get to work at 6:30 because I would look at my assignment. Usually the assignments were done by 6:30, and then I would go to the patient's room and I would look at the patient physically. I would get the patient's chart and I would read the last doctor's note, the doctor's progress note. They always write it, or you can always find it in the computerized chart, right? I would do that for usually I have 4 patients, all 4 of my patients, so that when I sat down to take a report, I was already familiar with the patient. And I could ask the nurse questions like, the doctor said today the patient could ambulate. Did they ambulate? The doctor has the patient MPO. Why are they MPO? Just to be more competent in what care I was supposed to provide. So I became somebody who really didn't know how to give a report or questions to ask, to somebody who became very proficient in it. People usually did not like giving me a report because I would ask them questions. I would have questions prepared. And that is one of the things you have to do if you're going to be a good nurse. You have to prepare. So get to work early. Allow yourself some time to familiarize your whole day with your patient. I work night shift, so a lot of things happen during the day that I needed to know about. All right. Because you know what? The bottom line is that you guys, you're working super hard for your license, right? You are working very hard. Some of us, it's taking us years to get this license, and we're not going to lose it over something silly that could have been prevented. That would be the worst thing, is to actually have your RN license, have a career, and then lose that license and have to go back to working in, another area that is beneath the education that you have. So I always take my license very serious. I don't play around with it. I don't just accept patients' assignments willy-nilly. A nurse would never tell me just look out for my patient while I go on break. No, I need to know about this patient from top to bottom. So listen, if you do that, if you become one of those nurses that ask questions, people will not just throw anything on you. All right. So that is my hobby horse for today. Okay. Now, giving handoff reports. Let me see. I want to make sure I have all the notes for you. Oh, okay. So another thing that I created for to be more proficient in handout. Let me read this though. Okay. So these are the things that the Joint Commission said that you absolutely have to give. This is the information you absolutely have to give whenever you're doing a handoff. So you have to, if you're giving somebody a patient, you have to give that person your contact information. Okay. So they say, okay, my name is Regina. I'm about to give you this patient. I'm going home, but write down my cell phone number in case you have any questions, right? You have to give the patient's diagnosis. You have to give when they were admitted to the hospital, their to-do list. You have to give their contingency plan and their allergy list, their code status. You have to go over vital medications, vital laboratory tests, and their last vital signs. So these are the recommendations of JCO. So I did a little video on YouTube called How to Give a Handoff Report. How to give a handoff report. If you have some time, please go on our YouTube channel and watch that video. It will help you out tremendously. It's not long, but I just do two different reports. I do a very poor one in the beginning, and then I do an appropriate report in the end. Now, to help me when I was a little nurse, baby nurse, I created these documents for myself. Everybody has a different way of how they like to remember patient information. I was a clipboard kind of nurse. So I created this document. Let me see here. You guys can see it. And essentially what it is a table for patients. And each box has topics that I would write down. So things that I always had to know when I was giving report are the patient's name, their age, their sex, their diagnosis, history, allergies, and of course their doctor and their code status. Doctor and code status. When you have a patient and it's a new patient and something goes wrong, you want to know who to call right away. And an emergency is not the time to figure out like, okay, who is this patient's primary doctor? Oh, okay, this patient are they under surgery or are they under pulmonology, like pulmonary? All right. So that is very important. You always need to know the sex of your patient. All right. I worked in DC for 2 years, and there are certain times when people would be dressed as the opposite sex, and if you don't really know, then you were going to get fussed at by the patient. Okay, so these are just important things that you need to know. All right, that you need to know. Again, I'm going to just read the JCO list again of things that you must tell when you are giving a handoff report. So we have your own contact information, the patient's diagnosis. You have to give their plan of care, a to-do, what they have that needs to be done, allergy list, code status, important medications, the pertinent laboratory values, as well as their last vital signs. But again, you can watch that YouTube video. Also, you guys have my email address. People email me for this document all the time. So if you email me, I will send it to you free. It is totally free. All right. And this is another one that I created, and it's just an hourly breakdown of the things that I had to do for my patients. So Here, along here are the hours, 8 to 8. And every hour, like if the patient had an IV medication due at midnight, I would be able to write at midnight, patient number, bed 4 or whoever, IV medication. And that really helped me to stay on track. I suggest one of these tools for any new nurse so that you're not just running all around trying to remember everything. It's very hard to do. I never trusted my brain or my memory when I was working because you forget, and prioritization is very hard. We're talking about management of care. If you guys want to know more about management of care, don't forget we have the DVD self-study program. In it, I go over the important topics of prioritization, delegation, all the things, like the primary objectives for NCLEX I cover in that DVD program. And I cannot stress to you guys enough, if you are trying to obtain your license in 2018, you need to get the resources that will help you. Just like I'm talking about these resources that help you organize your day, it's the same with your studying. Don't try to study for the NCLEX exam on your own. It's extremely tough. It's extremely tough. And I know it's an investment that you have to make. It's an investment in your time. It's an investment in your finances. It's probably an investment in your current work schedule, but it pays off. Read the testimonials, listen to the videos. People always say, I wish I would have gotten the package sooner. I wish I would have committed to studying for NCLEX sooner. The days are going by, and you should be seeing progress. If you guys have been with me since Remar Nurse University, it's time that you should be taking your exam. This is the month. This is July, and we're getting ready to go into August. And remember, somebody asked me about the shirt. The shirt is amazing. The shirt is for every Remar nurse who is able to study with us right here using the same things that you guys have, pass NCLEX. You give a testimony, video testimonial, and we sing you a shirt to thank you so much for your time. But you know what? The testimonies outlast everything else. The testimonies outlast everything else because they motivate and encourage the future Remar nurses who will pass NCLEX. And so they're so important. And I think that even those who are studying for their NCLEX exam are motivated by what they hear and what they see. Nurse Cassandra, she listened to the other testimonials and it encouraged her. Don't be nervous about it. Don't be nervous. You can do it. You can do it. And all the nurses that give video testimonials, they say, if I can do it, you can do it. That's what they say. If I can do it, you can do it. And that is so true. Don't feel like passing NCLEX is beyond your reach, because it's not. We have so many resources at remarreview.com. We have so many resources. If you have any questions about what's best for you, what product is best for you, what are the resources, don't hesitate to give us a call either. I mean, our number is there. You guys have it. And I'm looking forward to you guys. I know a lot of you guys are testing this week. So definitely some things that I would point out for you to study. Make sure you know. Do I have one in here? Make sure you know quick facts. Make sure that you know this book. Okay. Make sure that you know quick facts. And particularly, I'm going to open up quick facts and I'm just going to shout out some things. Okay. Make sure that you know. All right. Of course, all the medications in the back. I don't even have to go over that. You guys know that the pharmacology section in the back of quick facts is the truth. Okay. So make sure you know that. Make sure that you know the teaching for patients with pacemakers. All right. Also, you got to know Meniere's syndrome and how that will affect your patients. How that will affect your patient's sodium level. All right. Share this video if you know somebody that needs help with management of care, somebody that has quick facts. I get a lot of questions on the dietary implications for somebody with cystic fibrosis. What do you have to do regarding their diet? What are some things that will happen because of it? Okay. So congratulations. We got a new nurse here. New testimonial. Say it again, I'll read it. Is it nurse? I see Nurse Brenda. Congratulations if you passed your NCLEX exam. I am super happy for you. Okay, I'm super happy for you. You guys know you got to know about your isolation and infection control. I go over that in the student DVD workbook. But once again, here are the DVDs that I teach from. All of my teaching that I have come from these 4 discs. And I am so confident that if you have these discs, you feel well prepared for your exam. Okay. yes. I'm trying to tell you. Let me see. So quick facts. You guys know quick facts. All right. And you love it. An important thing also when studying for your exam is to make sure that you're not studying from too many resources. I know a lot of you guys have the quick facts book and you want to pair it with other things, but be careful with that because the quick facts book was only made to go with the DVD program. So there are things that you may not see in quick facts, but it is because they're in the lecture DVDs. And so together they give you a full picture of what's on NCLEX. If you just have quick facts, you will notice that there isn't anything on prioritization or infection control in the quick facts book. And that is because I specifically lecture on those topics, all right? The management of care topics, because they make so much up of your NCLEX exam, I specifically talk about those topics, okay? So just a point that when you're studying, make sure that you cover all of your bases. One of the things you don't want to do is sit down in front of the exam and think, oh, I wish I would have studied, or I wish I would have spent more time on this certain section. When you sit down and take that test, if you're testing this week, you should feel like, okay, my brain is going to explode. I cannot take any more. It's a feeling of saturation. Like I've studied so much, I'm just ready to do this. That is the feeling that you're looking for. It's not, oh, I need to give myself more time. If you need to give yourself more time, just reschedule the test. It's better, it's easier for you to do that than to sit and take the test, okay? So we were talking about our NCLEX question of the day. If you missed it, the answer was number 4. Both nurses were responsible for that patient falling. Both nurses had the responsibility to assess whether they were fully competent enough to care for the patient. So that was the NCLEX question of the day. We will be doing NCLEX questions every week. So look forward to them because I sure do. I loved reading the comments and just kind of seeing how you guys were thinking, right? Yeah, it was fun. Today was fun for that NCLEX question. That was kind of a tough one. All right. So if you have the quick facts book, don't forget all the medications in the back. Know them. People ask me all the time, how am I supposed to study all these medications in the back of quick facts, Regina? Like, what am I supposed to do? I say, try your very best to study them directly from the book. And those that you really have a hard time studying and memorizing, make flashcards for those drugs only. I don't suggest making flashcards for the entire book right now, but if there are certain topics that are really difficult for you to study, make flashcards on those topics, okay? All right, you guys can do this. It is totally possible. I'm going to leave you with that encouragement today. Quick Facts needs to be your best friend. If you need the DVD package, don't hesitate to get it. You can get it at our website, remarreview.com. remarreview.com. We're going to put it up because there's a lot of free resources on the website, remarreview.com as well. We have the trial version of the online program. That's totally free. You can go on there and listen to lectures online. You can go in there and do practice exams. It's a place where you may have the book for quick facts, but you might not have the DVD that goes with the quick facts book. And that's really a popular study tool for students who are wanting to know how much they know from the quick facts book. The DVD, do I have one here? I don't know if I have one. The DVD that goes with the quick facts book is super helpful. And you can get that on the website too, remarreview.com. So I just want to say thank you guys for participating in Let's Talk NCLEX. It was fun today. It was fun today, and we learned a lot. So thank you so much. Let me see the DVD. Here's the DVD. If you guys don't know, it actually says quick facts for NCLEX on the DVD. And you can't get this anywhere but the Remar Review website. So if you look for it on Amazon, you won't find it there. But they go together. So I do recommend them. And this DVD, a lot of people ask me, this DVD is different from the 4-disc set. So it's different from, these are 4 that are lecture. And then this one is just for quick facts, okay? So they don't come together, all right? So yeah, if you have the DVD, then it is helpful for you with the quick facts book, okay? All right, I'm reading the comments. You guys can do this. Again, my email address is support@remarreview.com. I will see you guys on Monday. Have a great day. Our class motto is, we can, we will, and we must pass NCLEX. We're saying that for the rest of 2018, and that is our motto moving forward. That is our goal for you. So keep studying here with us at Remar Review. It is our pleasure to help you in any way that we can. Have a good evening, guys. Bye-bye.